Hey guys, it's Dr. Thomas with Plum Health, and today I'm talking about a unique subject, and that's health information and where we might be going in this new healthcare ecosystem. So I firmly believe that patients should have all of their health information. That means you, the healthcare consumer, should really own and control all of your healthcare information in terms of your medical records for your past history, all your lab work, all the notes that are written about you by your doctors. All of that should be very clear, transparent, and owned and protected by you. That way, when you go to see different doctors, you can just share. Maybe it's on a thumb drive that you give to your doctor, they plug it in, are able to review all of your medical health history really easily and seamlessly, and deliver the best care possible to you in that moment, knowing all of your history and being able to see that in a relatively short amount of time. The way things work now is that health systems and large hospitals own your health information. It makes it really difficult for you, the healthcare consumer, to understand what's going on with you. And then in the case of emergency, it's really hard for maybe a treating ER physician to know exactly what's going on with you, your allergies, your histories, some of the reactions you had in the past to medications, if they can't collect your information quickly. This happens all the time. Say you go to big hospital X and they typically have all of your information. You go there for all of your routine and regular care, but then you have an injury that's close to big hospital Y. They don't have any of that information, and it's very difficult to share it. I know that some software systems are starting to integrate, but I think in an ideal system, you, the patient, the healthcare consumer, would have your own healthcare information. That's why I'm really excited to talk about this next thing that's been recently FDA approved, and it's really this product by 23andMe. I don't really mean to be an advertisement or anything, but I think that this is really neat in that you can now do your own genetic testing at home and then own that information. So they released, this is the first direct to consumer marketing for healthcare information that's been FDA approved. So you can essentially give a saliva sample, send it to 23andMe, and understand what your risk might be for Alzheimer's disease or Parkinson's disease or 8 others. So there's 10 genetic testing components in this. There are some risks, right? You may not understand this information fully, or you might get a false positive or a false negative, meaning that if you get a false positive, you don't actually have the disease and you test positive for it. False negative is you might actually develop the disease, but the test wasn't sensitive enough to pick it up. So this is not without risks, but I think on the whole, this is a great thing. It leads to the democratization of our healthcare information, and I'm really excited about that. As a part of what I do in my direct primary care practice, I make the health information that we talk about really easy to understand and really easy to access, meaning that I'll email you your test results once you say that that's something that's okay for me to do. And I'll share that information really readily. I'll share our treatment plans really easily so that we're on the same page about treatment. Because the more you understand your health information, the better decisions you can make about your health care. So on that note, I think I'm going to close out. Thank you so much for watching. Again, my name is Dr. Paul Thomas. I'm a family medicine doctor with Plum Health Direct Primary Care. So thanks again and have a great day.